Hello my dear friends, welcome to the Sandhya Nursing channel. So in this video we are going to study about steps of nursing process. Nursing process helps the nurse to organize and deliver effective nursing care. So it includes 5 steps, right? Nursing process helps to the nurse to organize and deliver the effective nursing care. So this is there are mainly 5 steps of nursing process there. Steps of nursing process, there are mainly 5 types is there. So which are they are following below. In the nursing process, steps of nursing process, there are mainly 5 steps is there. So first is nursing assessment, nursing diagnosis, planning, implementation and evaluation. There are mainly 5 steps of nursing process there. So in this video we are study about nursing assessment in detail, about the nursing assessment definition, purposes, components and sources of data. So in detail we are going to study about nursing assessment. So first is nursing assessment. So definition of nursing assessment. Assessment refers to the collection and interpretation of clinical information. It focuses on gathering the data about client's statement of wellness, functional ability, physical status and strengths and responses to actual and potential health problems. So nursing assessment is nothing but it is a collection and the interpretation of the clinical information. Means the nursing assessment is nothing but this is a functional abilities or the physical status of the clients, whatever the patient is having some problem. So the first priority is being a nurse. What is your rule means, when the patient is entered to the hospital, first we are going to assess to the patient. So assessment is nothing but first patient's status, like in the physical status, whatever the problem is there in the physical status, and what is the strength of patients, and actual and potential health problems are assessed in the nursing assessment, means in the first assessment. So actual is nothing but whatever the present problem is there. So present problems is whatever the patient is having, that is actual, and potential is nothing but further complication in the future, or further complication are happening, means that is a potential health problems. So this is a nursing assessment. Nursing assessment is nothing but it is a collection of data data or information about the client, that is actual or potential, or whatever the client function abilities or physical status, that all are come under the nursing assessment. So this is about nursing assessment. Next is purposes of nursing assessment. So what all are the purpose of nursing process? They are to gather information regarding patient health. First purpose is that information regarding the patient's health, whatever the patient is having some problem. So according to the problems, information collection, that is to gather information regarding patient's health. So this is first purpose. And second purpose is that to determine client's normal function. So second purpose is determine the client's normal function, and third purpose is to identify the health problem. For the identifying the same problems of the patient, so that's also nursing assessment is helps to us. So this is a third purpose of nursing assessment. And fourth, that is to identify need for health teaching. So to identify need for health teaching is nothing but whatever the patient is need, so according to that we should be teach to them. So whatever take an example for the nutrition or something else, so the patient is whatever the need, so we should be teach them. So that is a health teaching, to identify need for health teaching. So what actually patient is want, so that we should be provide to identify need for health teaching. Next is types of assessment. So in this types of assessment there are mainly 4 types is there. First is problem focus assessment, time lapse to assessment, emergency assessment, and fourth is initial assessment. So these all are the types of assessment. So first types of assessment, that is initial assessment or admission assessment. So admission assessment is nothing but it performed when the client enters the healthcare facilities. When the patient is entering to the hospital, that is a admission assessment. Is a performed when the client enters a healthcare facility. Then second is focus assessment. So focus assessment is nothing but a collect data about a problem that has already been identified. So in the admission assessment, we are already identified, means whatever the patient is having some problems, that we should be identified in the admission assessment. So focus assessment is nothing but already identified problems. So that is focus assessment. Then third is time lapse to assessment. That is one which is carried out after a initial assessment. So time lapse to assessment is nothing but it is a after initial assessment. So after initial assessment is nothing but after the means admission assessment. Admission assessment is also called as initial assessment. Then fourth type of assessment, that is emergency assessment, is one which is done in life threatening situations where preservation of the life is a top priority. So emergency assessment means this is a life threatening condition, means in the end of the situation of a patient, means a life threatening conditions. So that is emergency assessment. So take an example, assessment of patient's airway breathing status and circulating after a cardiac arrest. So this is an emergency assessment, right? The patient is having obstructive or airway or breathing difficulty and circulating of cardiac is arrest. So that is an emergency assessment. Next is assessment activities or components of assessment. There are mainly four types of components or activities is there. First is collection of data, documenting data, validation of data, and organizing data. First is collection of data. So collection of data is nothing but collection of data is a process of compiling information about the client, both subjective and objective. So collection data is nothing but it is a compiling of information about the client, that is subjective and objective. So what is subjective and objective? So first is subjective data. Subjective data are symptoms are covered cues are the client's feelings and statements about his or her health problem. So subjective data is nothing but the patient is telling to you whatever he or she is having problems. So whatever the patient is having some feeling, so whatever the problem he or she is suffering, so that all feelings they are told to you. So that is subjective data. So whatever the patient is having problem, she or he is telling some health problems, that is subjective data. So what is objective data? So objective data is nothing but signs or observable, perceptible and measured data. So subjective data is nothing but whatever the patient is tell to you, means already the patient is told you. So whatever he or she is feel or whatever health problem is there. So being a nurse, so what is your role means in the objective data we should be observe the signs and symptom of the patients, and we should be observe whatever the patient is telling to you. So that is objective. In the subjective data, whatever the patient is having problems, the patients only can tell you, that is subjective data. So after that, what is objective data means whatever the patient is already told you, so you can be observe the signs and symptoms, and whatever you can observe in the subjective data means whatever the patient is telling you, so that we should be record or observe or measure the data about the patient. So that is a subjective data. The next is sources of data. Sources of data is a subpoint of the collection of data only. So what is sources of data? So in the sources of data, there are mainly two important sources of data is there, that is primary data and the secondary. So what is primary source means is the clients himself. Clients himself is called as a primary source. And what is secondary source? So secondary source is nothing but family members or significant others like health recorder, laboratory tests, or diagnostic procedure. So these all are the secondary sources, means family members or significant other health recorders. So this is the sources of data. Then second activities of assessment are second a component of assessment, that is second is documenting data. So documenting data is nothing but systematically record the data collected, which will form a permanent part of the medical record. So document data is nothing but whatever the patient whatever we are record about the patients, mean whatever the patient is giving to gave to you the information, so that all are record is we are systematically recorded in the nursing chart. So right, so that is a systematically record the data collected, which will be form a permanent part of medical record. So once you record in that chart, means this is a permanent, this is a permanent document data, is called as a document data, permanent part of the medical record. Whatever you are record already in that chart, so this is a permanent data, is called as a documenting data, that is medical record. Then third is validation of data. So validation of data is nothing but it is a process of confirming the accuracy of the data collected. Validity is nothing but a process of confirming. So whatever the patient is having problem, so we should be confirming that problem is actually that problem is happening actually, that is confirming the problems, that called as a validation of data. Then fourth is last components or activities of assessment, that is organizing data. The data collected is organized on the basis of some models or framework. So organizing data is nothing but it is a collection of the organized based on the some models or framework, is called as a organizing data. Take an example, functional patterns of patients or head to foot ties framework. So these are models, is called as a organizing data. Thank you for watching. If you have something doubt, means please text in the comment box. Thank you for watching.